I'm Ashley Pinet. I'm a registered dietitian with Student Health Services at NC State. I did my undergraduate degree here at NC State in biology with nutrition concentration. I originally came here thinking that I was going to go to dental school, and then I took Nutrition 301 with Dr. Ash, and my path just completely changed. I knew that I had found my passion. After completing my degree program here at NC State, I went to Meredith for the dietetic internship. And my first job out of the internship was with Cape Fear Valley Hospital in Fayetteville, working as a clinical dietitian in their long-term acute care hospital. So all of my patients there were on ventilators and required either tube feeding or TPN, total parenteral nutrition. I worked there for about a year before the commute just became really challenging for me, and I took a job with long-term care and short-term rehab units within the Raleigh area, and I was a floating dietitian, so I traveled between facilities managing patient nutrition, but also overseeing the food service operations in those units. I also did some consulting during that time with a home health company, managing tube feeding for cancer patients who were being discharged from the hospital. And during my undergrad here at NC State, I was an intern with health promotion within Student Health Services. I interned here for about 2 years as a student teaching nutrition classes around campus. And when I had been out working as a dietitian for a while, my supervisor here actually gave me a call and said, "We're hiring a dietitian in student health. Do you want to come back?" So that was 5.5 years ago, and I'm so glad that I made the decision to come back here today. My current role with Student Health Services is to provide outpatient nutrition counseling to NC State students. One of the best opportunities that I had was being a student here, and that really helped to connect me with the campus culture, as well as understand what food options are available on campus. And I knew a lot of the faculty and staff already just from my time here. So that was a huge help in transitioning to this role. It just made it a lot easier. I felt like I was coming back to a place that I'd already spent 4 years at anyway, so it just made it that much easier. I've had extensive training in weight management, motivational interviewing, college healthcare, and eating disorders. So each of those trainings are things that I use every day in my role here. A good portion of my time is spent providing one-on-one nutrition counseling to students. We talk about anything from general nutrition to weight management, sports nutrition, disordered eating, PCOS. I really get to see a variety of conditions and concerns, a lot of complex situations that really challenge me to continue growing as a professional. In addition to the clinical responsibilities here, we have a couple of treatment teams in student health. So I'm a member of the eating disorder treatment team, which meets twice a month, and we talk about our clients. We have representatives from the counseling center and from student health services, and we just make sure that we're all on the same page to coordinate care for those patients. Additionally, we have our diabetes treatment team. We meet once a month to talk about our students on campus with diabetes and how we can best manage their blood sugars during their time here. I also supervise 2 dietitians, so we have another full-time dietitian and we have a part-time dietitian. So I provide coaching to them through challenging clients, but then also just oversee their day-to-day operations and review their charts. Another big part of my job here is providing outreach. And so I teach classes around campus. I partner with the residence halls to teach nutrition classes in the dorms. I also partner with University Recreation. I do a nutrition lecture for their personal training course, and I also do training for the current personal trainers within University Recreation. I work closely with the Wood Wellness Village. So I recently did a nutrition program for them, and we built trail mix and kind of talked about managing healthy eating on campus. We do tabling events around campus, and we also provide different events that raise awareness around eating disorders and send body positive messages. I use nutrition in my current job all day, every day when providing nutrition counseling. And so the great thing about nutrition, and also the challenging thing about nutrition, is that it's changing and it's evolving, and there's always new research coming out. And so it's important for me to stay on top of that research, but also understand human behavior and how to apply that research to practical everyday applications to help people meet their health-related goals. After graduation, I realized the importance of having a non-judgmental approach to nutrition care. When I was a student studying this, I would tell anyone and everyone my opinion of what they were eating, and oftentimes I would use language about that food is bad for you or you shouldn't be eating that. And I learned that that creates shame around food, and that's actually a barrier for clients to making change. And so it's really important to have a non-judgmental approach to nutrition care. That just really allows the patient to feel comfortable and opens the door for change. And so I help my clients figure out how they can improve their nutrition, what they can be eating, and we focus on that and not what you shouldn't be eating. So most people understand that they shouldn't have pizza and cookies for every meal, right? They get that, but making that behavior change is a little more challenging. So I talk to them about nourishing their body on a cellular level and how they can feel their best. The accomplishment that I am most proud of is the ability to impact students' lives every single day. I get the chance to form relationships with them. Sometimes I see clients for years, 4 to 5 years during their time here, and so we really build strong relationships, and I get to see the outcome of our work together and our time together. So some of the major exciting things that happen are seeing lipid levels improve, or improvements in hemoglobin A1C, or having a client that meets their weight loss goals. One of my favorite things, of course, is seeing progress with disordered eating patients. And so I actually, one of my clients was a former model, and when she finished treatment with me, I worked with her for 3 years, and when she finished treatment with me, she actually gave me her tape measure that she used from her modeling days, and she wrapped it up and she said, I want you to have this because I'm ready to move on from this, and I am ready to start my career free of my eating disorder. And so I have these powerful opportunities to impact the lives of other people, and that makes every challenging moment completely worth it, and it makes it a really fulfilling position to be in. Looking back, one thing I would have done differently to prepare myself for this role is to take more classes in human psychology and human behavior. A lot of people understand what food choices would be better for them. It's often difficult to make those choices. Food is used as a coping skill a lot, so helping people understand how we can change their behavior, find different coping skills, is really crucial to them having success with their health-related goals. It's one thing that as I'm in this role, I continue to learn on my own, but I think it would have been more helpful to have on the front end. The advice that I would give to current nutrition students is never say never. During my entire time that I was in school, I always said, I'll never be a clinical dietitian. And then as soon as I finished my program, that was my first job that I took out of school. And I'm so thankful that I did that, because each job that I had prior to this one really prepared me for this role, either in building my skills as a counselor or understanding more about disease states. Each of those opportunities was a learning opportunity. And so don't pigeonhole yourself into one particular path in nutrition. Try out a lot of different things and figure out what works best for you and what brings you the most joy.